What are we doing? We're getting healthcare done. Welcome. My name is Nicole Christensen. I'm a patient advocate and CEO of Care Answered, providing patient advocacy and care coordination, as well as the founder of Answers for Care. Answers for Care is a one-stop shop for all of your aging needs. I'm also the best-selling author of the book From Crisis to Calm. And again, we're getting healthcare done here. And I have a fabulous guest because we're talking about different ways to get the services that we need, especially counseling and in therapy. And I have a great guest who I've known for quite some time. We've worked together many times with many clients. And her name is Lucia Jamaluddin. She is a therapist. She specializes in neurodegenerative diseases and counseling for families as well as those who are going through it. And she has a lot to share today. Welcome, Lucia.
Thank you. Thank you, Nicole, for having me. I'm very happy to be here.
Oh, thank you so much. I was really excited about today and to speak with you. And we like to start the show off with something we're grateful for, because I still believe grateful people are happy people. So if you could share with us something that you're grateful for today.
So I think about this a lot, and I have the privilege of working with individuals at their toughest, and we talk about gratitude daily. So for me, obviously, my top are my health and my family every single day. In relationship to kind of what we're talking about today in career and just profession, I'm very grateful for my husband, who has just been completely supportive in my this chapter of my career and being able to have a private practice and doing what I really love to do, and just not doubting me at all and letting me go for it, even though it means certain sacrifices had to be made with raising a family and, just having a house on Long Island. So,
Absolutely.
So really today, that's what I'm super grateful for.
Oh, that is so wonderful. That support system makes all the difference. And not only as a mom and a business owner, but for your clients as well. For every person, we all need support. I think what I am grateful for today, there are so many things to be grateful for. So again, my health. Mother's Day was not too long ago.
Yes, happy Mother's Day.
Happy Mother's Day to you. And I had such a lovely time and so blessed. I got to see my siblings. I saw my sons, of course, and we had a great day together, and just celebrating life. We had a beautiful day. So I'm grateful for the blessing of being a mother, and to be able to celebrate Mother's Day with people that I love.
That's beautiful.
So let's get into it. You talked a little bit about this next chapter in your professional career. So tell us, what led you to being a therapist? What was your journey? Everybody has a different one. I'd love to hear yours.
So, for me, when I think about kind of twofold, right? So I have my passion with the neurodegenerative community, and that's separate from my passion to being working for myself. So when I think about the component of working for myself, I think about my father, who is self-employed, who came to this country and built everything on his own, which really motivated me to look at how he lived his life and say, geez, that's a wonderful way of being your own boss, but doing what you do best. Compounded with my mother of just never giving up on yourself. Whatever you do what you need to do and never give up on yourself or think twice about what you can offer. So that combination, I think, is what allowed me to really just not give sight of my vision of wanting to be a mother and also a professional that does what I truly love to do. The other component of why neurodegenerative is I grew up in a family with Huntington's disease. So having seen that family dynamic go through a lot of just obviously heartache and loss, that really made me want to give back to that community, to know that I am healthy and don't have to have that burden with me, but I can help other families navigate that world. So both of those together really helped me kind of go down this path of private practice. I've had a lot of experience in nursing homes and hospitals and group homes, support groups that I've always seen what is the next gap that is needed, right? So starting out from mental health to elder law to learn Medicaid, which turned into nursing home care to understand how do people get into long-term care. From that to, well, wait a minute, there's folks in the community who don't know how to get proper long-term care support. I want to do that now. To, I really want to help people more of an individual level to understand what they've lost during this journey of dealing with chronic health issues. So I'm really blessed to be able to have taken this leap to do this now.
Yeah, absolutely. And that inspires you as well as so informs you in the work that you're doing now.
Correct,
because you've had all of this wonderful experience.
Yes.
And I know with Huntington's disease, that's a big, I find that I learned about Huntington's disease probably soon after I met you.
Yeah, that's
right?
kind of how we met.
Yeah, that's how we met. And I'd heard of it, but I didn't really know what it was. And from the experience, and I've seen you in action, informing people about Huntington's disease, as well as being a support for those that, and the families of those who have Huntington's disease. And it's really quite devastating, the disease.
Yeah.
And I've had the privilege and honor of having clients with Huntington's disease and finding the right support for them when support at home is very difficult. The systems are not really built for, so a skilled nursing home, for example, is not really built for somebody with Huntington's disease because it's not like their typical resident.
Exactly. Yeah.
And so that is a hard fight. It's a long fight. It's a battle that is everybody's on deck for it. And it's just so interesting and enlightening to see people struggle with it, and that there's services that you offered that can help people through it. And it really takes a team with any kind of disease within your family, but Huntington's disease is one of those that it's also lesser known, right? So it's not like there's information about it everywhere you go.
Exactly.
Right?
Yeah.
So thank you for your work in that.
Oh,
I know how beneficial it is to all families. But tell us you told us that Huntington's is a neurodegenerative disease. What are some other neurodegenerative diseases that we might see more often or less often?
So that's kind of the overlap, right? You have Huntington's, which people might describe as a combination of Alzheimer's, Parkinson's, and MS together, or ALS, Parkinson's, and MS together. So when we think of neurodegenerative diseases, it's an umbrella term for these chronic progressive conditions that basically cause nerve cell death in the brain and in the nervous system. And it's an umbrella term for Parkinson's, Huntington's, dementias, like Alzheimer's, ALS, prion disease, multiple sclerosis. And these diseases, unfortunately, although they're not curable, they are treatable. They're not curable and they're progressive in nature. So over time, the individual will lose their ability in their mobility, possibly cognition, and sometimes behavioral decline. And, you see a lot of psychological issues, and they ultimately will require long-term support. They might have difficulties with swallowing, eventually speaking, and just decision making. So these diseases really, they start a lot of times either at the prime of your life or just when you're about to retire and start that chapter of your life, and they just go with you to the duration. So you're living with it. And it's not just the individual that's being diagnosed, it's usually the family too, because the family now has to build this tribe to kind of understand how to now plan for the future.
Right. And when I said all hands on deck, that's for all diseases and all the symptoms that come from those diseases and the effect it has on our families, right? And tell me a little bit about that. So I imagine, and I've seen with my clients, that especially ones we've worked on together, it's emotional, it's financial, it's certainly medical and physical, and mental. And what are some things, without getting too specific, but things that people come to you when they have these diseases or their families, that they don't know or they're completely not prepared for, and you wish everybody knew this?
So it's such a good question, because I'm getting folks at this time in my career on a very individual level. So they're coming to individual counseling. They're usually coming to me when they're absolutely broken, vulnerable, desperate. They've waited a long time to make the phone call, or they haven't found someone that really clicked with them, or finally someone who takes their insurance. So, teasing out all of that, they finally get to a clinician and they are pouring everything out. And what they don't realize, that I think they're shocked at the end, is that what you're experiencing is so common, because they feel so isolated that, how can this be happening to me? But it's so common what they're feeling, what they're experiencing. They're not alone. And also, they're very resilient. I think by the time they come to therapy, they feel broken, that they're not as resilient. But after even one session, sometimes we go through kind of a little bit of a history, and I see like, wow, this individual has been through so much. Do they not recognize that? And I'll kind of highlight at the end, like, let's talk about what you just said, what you've been through, and you've been through that. What makes this different? And they're kind of taken back when they hear that and realizing, you know what, I am strong. I am resilient. I can do this. But this is challenging, right? We can't take that away from the individual. But just to kind of remind them that they have a core strength about them that can get through this, and they're not alone, and that there's so many resources out there if you allow yourself to dive into that. Right. Not just the therapy piece, but just the community piece of it. With these diseases, you need to kind of find your community to know that you're not alone.
Yeah. I say that a lot in Care Answered. It's like, you are not alone.
Yeah.
When we talk about the number of people that are caregivers, for example, in the United States, it's, when last polled, it was something like 48% of workers said they were a caregiver for an older adult. So that's even more specific. For an older adult or an adult, and then 49% said within the coming 5 years they will be a caregiver for an adult loved one. So we're definitely not alone. Again, not a mathematician, but 48 and 49 is pretty close to 100%. So I think it's so important, and I think something I'm hearing from what you said is that the best time to find help is earlier.
Yeah.
Right?
Yeah.
As a patient advocate, the same thing,
Yes.
right? I can always help, and you can always help. But if you recognize that there is help out there, and nobody is doing anything alone.
Yes.
Nobody does anything alone. No matter what they tell you, the whole pull yourself up by your bootstraps, that's not real. Everybody has people around them that are in their corner, that are helping them in some kind of way. And so when we reach out, whether it's community or therapy or just resources, the sooner, the better.
Yeah, absolutely. And that's kind of something that I feel like I see especially with our caregivers, is they might come to therapy wanting to be able to talk about also just, how do I navigate this? This is really tough for me to see my husband or my wife go through this. But we talk about the anxiety that comes with the future. And something that I try to bring, that I wanted to bring from my previous job to here, is the resources. That part of managing the anxiety is actually having the answer, knowing where to go to when you get to that point, right? So we can talk about how this makes you feel, but let's actually play it out, right? Have you thought about adapting your home? Have you thought about finances in the future? Here are some resources. So part of my role also is not just the social piece of it, but it's that case management. Like, you feel better knowing that you left therapy with a number to a resource, right? That knowing that this is something I could do. I have that control back, because that's what's happening. There's loss of control. And there's a piece of, when you're newly diagnosed, we'll go through the gamut of grief and denial and all of that. And it's so hard to really make sense of what's happening and what this means to the family. So it does take time for an individual to kind of get to that point of needing help, because they don't even know what that means. What does help even mean?
Right.
You know, we just got this news, but we went back to our regular life after that appointment.
Right.
Life just goes on. You know, my husband or wife don't look any different than they did an hour ago.
Right.
You just have this new information about the uncertainty.
Right.
So patience with yourself to know that when you're ready, the help is there, but don't block it, you know,
Right.
go for it.
Right.
Yeah.
Right. Absolutely. There was this show that I try to use this. I think it was called This Is Us, and the family said, "Okay, what's worst case scenario? Just throw it out there."
Mm-hmm, mm-hmm.
And I use that myself, especially with my
Yeah.
children. What's the worst case scenario? Yeah. Okay, so let's get that out of the way. Let's get that out of our head and roaming in there and just spew it out.
Yeah.
And then say, okay, if that were the worst case scenario, and sometimes with my family, the worst case scenario is like not something that could possibly happen, and we just
usually,
but it's just it's just something that's in your head, and when you put light on it, you recognize, okay.
Yeah.
But some of them are possibilities, and so again, speaking to you, speaking to a therapist like yourself, and knowing, hey, okay, that could happen. What can we do to prepare for that?
Yeah.
What can we do so that it doesn't come as a surprise each and every time?
Absolutely.
Because we don't really have control over anything, right? That's just the way life is.
That's true.
And I'm not belittling or downplaying having any of these diseases or being family members or caregivers at all. But there's a little bit of relief, understanding you don't have control over anything, but you can know, okay, this is the journey that might happen. How can I prepare? Yeah.
Yeah.
So.
And it's interesting because I think that's something that you hold on to when you're diagnosed with, you know, Parkinson's, Huntington's, any kind of dementia, MS. The first thing is treatment options, right? So symptom management. So you instantly, the caregiver, the care partner, the individual, grab onto that treatment and put a lot of weight into the expectations of what that treatment is going to provide this family. If we do this, if we exercise, if we do all these things, you know, they know that it's not going to stop the disease, but it might slow it down. But I think that sometimes those expectations can become unrealistic over time. And then when the disease declines inevitably, you know, whatever it might be, there's almost like they got hit again with that diagnosis again. Oh gosh, this is real again. But we do this all the time. We keep going to groups, we keep doing our boxing, or we keep taking our medications, but it still catches up. So there's so much emotional ups and downs. And I do tell people, you know, if you can get into therapy sooner, it is better, because it will help you prepare for those ups and downs. And you'll have a better relationship with your healthcare team too. Because when you manage your expectations, then you're better able to handle your own feelings, what your partner needs from you, and you work better as a team with your doctors. Right. Because then that resentment kind of isn't there, you know, but you said if we take this, it'll work, or, you know, it just manages where you are in that state of time. Right. With your disease. And
that's hard for anything, right?
Yeah.
The you know, why me? I've done this, I've done this, I've done this, I've done this. There's another thing that we say in my family. It's just like, why not you?
Well, we do that a lot.
And it's and not only, again, not undermining or belittling people that are going through this disease at all. I'm talking about even for good things, right? Because that's the other thing. Like, how did this happen to me? We were talking a little bit offline about imposter syndrome, and when starting your own business, I feel like that happens sometimes, and it's like, why not you?
But why not you?
Why not you? Yeah. So you can look at it that way too. And again, all of these things are hard when you're living through it. And again, the support that you can have beforehand can be super helpful. Because just like anything else, when you're broken down, it's a lot harder to build back up.
Absolutely.
If you went to this level, to get back to this level isn't as hard than if you're here and you're trying to get back up to here.
Absolutely.
So again, just for all of us, not only just therapy, but community. Relationships, resources, let's all avail ourselves of them. And and you are a wonderful resource. I have
you.
actually, again, truly worked with Lucia for many years, and I've had the great blessing to work with her patients, and it's amazing. Everybody that's ever worked with you that I've come across, it's like, she's amazing. She's amazing. I'm like, I know.
Thank you.
So I
You've
think
helped
it's
many of my patients too. I always know it's a good resource to be like, Nicole will know. She'll help you. Just give her a call. She'll guide you, because sometimes you just have questions, and you just need to kind of run it through and make sure you have another professional. Make sure you're doing the right thing for yourself, and you've always been there.
Thank you. I appreciate that. So what is the most common reason that people come to see you, to utilize you as a resource? So we understand diagnosis. We understand, you shared with us that sometimes people wait till they're broken down. What do you see most common? Is it the I'm broken down now, or is there something that just hits them? So as a caregiver or a patient?
Yeah, lately I have been getting I need help navigating my spouse's illness, but also things are coming back. Things are coming up from my life that I need to address now. And I get so, I get a little like goosebump, pimply when I think about this stuff, because I really think that that's exactly what happens when you hit a certain time in your life. Unresolved trauma, unresolved issues, you're just building your family, building your career, working, and then life slows down, and no matter how much you try to hide it, your past will always come back, right? Yeah. And so especially if it's heavy stuff, things that really have impacted you. And that's what I see a lot, is individuals just needing to finally face things that they either regret or have happened to them that they never placed a proper space for it, and seeing that their future has been impacted by this illness, whether it's a care partner or an individual. You're now faced with time, and you have to kind of come to peace, and they want to find peace.
Right.
And I feel that that's what I've been seeing a lot lately is people who just want to really come to peace with certain things in the past.
Right. And that totally makes sense, right?
Yeah.
I didn't think about that, but when you're in it, I think caregivers that I see as well, they will be so focused on the person they're giving care to. They forget about themselves, and that's bad news. Well, because we know the statistics. If you don't take care of yourself as a caregiver, they generally get sicker before the person they're caring for. So we really need to take care of ourselves, no matter who we are, because people count on us.
Absolutely, and it's your life too.
Yes.
Right. So you hear that a lot with care partners, that they feel kind of selfish, or they don't want to burden people by talking about how they're doing, because their partner is clearly in worse state because they're the ones with the disease, and there's all this feeling of guilt and burden and just selfishness. And we try to work on really allowing them to not feel that way, that a better you is a better them.
Correct.
And this is your life journey too. You have to give yourself the space. If these are coming up for you, if this is coming, and let's say if it was a marriage that really wasn't that well, let's say you didn't have a healthy marriage, and now you're in this dynamic where you have to care for this person, and for whatever it is, you're now feeling a lot of heavy feelings about, I'm giving more. And now I'm not going to get anything back, because this person's only going to get worse with time. Right. So I'm losing more of my independence, my time, my purpose in life for this individual. So all these feelings come up. And I do think that giving yourself that space to really find a place for it can be healing.
Absolutely.
And asking yourself, what kind of care partner can I really be? What does that mean for me? Some people think that, nursing home is the only option. Some people think that there is no other option but paying out of pocket for healthcare, so they don't realize, again,
the
what's
options
out
that they
there,
have.
Don't let your anger or your sadness take over. We can have a space for that and have a space for planning. Right.
And one can make the other a little easier.
Yeah.
Right?
Absolutely.
That planning space. So what are some good linkages? Because you talked a little bit about community, resources. What are some, if you could share, some of your kind of go-to for different patients that you have that have neurodegenerative diseases?
So depending on obviously what the disease is, I really enjoy working with the local chapters of those diseases.
Yes.
For example, APDA, LIAD, ADRC, Alzheimer's Association. They are wonderful resources for these families because I always tell them, as soon as you're diagnosed, just give a call. Get on the email distribution list. Just know what's out there because they are loaded with social workers, support groups, just programs that are in the community, and they also, run the gamut of all of Long Island.
Right.
So they'll tell you also if you're not in their catchment area where to go.
Right.
So I just feel like those are wonderful resources for individuals.
Absolutely.
And also just knowing where do you live and know about your senior centers in your area because they have a lot of wonderful resources. So that has been always helpful.
Yeah,
for
I
me.
agree.
Yeah.
I agree. And it's amazing how few people know that these things are around because they're new to the diagnosis or they just, again, that whole feeling alone. Right?
Well, so that's the thing, right? So someone gets newly diagnosed, they come to you and they feel automatically like, how do I not know this? How am I going to do this? And I always tell them, you're not supposed to know this.
Right.
Up until now, you've been living life knowing other things, right?
Right.
It's our job.
Yeah.
Now let me come in and tell you what you're going to know. Like by the end of this, you'll be an expert yourself, right?
Exactly.
Like, unfortunately, and you'll kind of know what's out there. So I always tell them, support groups. Don't think about a support group in terms of, oh, but I'm not a kumbaya person or I'm not really a social person. It's really not about that. Go in when you're ready with a question, with a resource, and just know you will get resources that way. You'll hear about someone who did something or who met somebody. And it's such a wonderful way to know that, oh, okay, it's not just about, maybe you don't want to talk about your feelings right away, but it's a great way to just know what's out there.
Absolutely. And that's really well said because I think people hear support group and they get afraid.
Oh, I love talking to people about support groups.
I know.
I love it.
And you've led great ones.
Yes.
And so just the idea of just going in and saying, okay, interesting, I'm looking for this. Does anybody have that?
Yeah.
And you will actually get answers. So you don't have to be somebody that's going to share, but you can learn.
I do get a little mama bear when it comes to the support groups. If someone comes and has never been to one, I always tell them, please do not go in blindly. Call first. Ask about the group dynamic. Let them know who you are a little bit. How is it led? Is it professionally led? Is it peer led? Just to kind of know, because I've had people who have gone to one group and didn't have a good experience and will never go back. And that's another I always feel like that's so sad for me to see. So I always tell them, please, always call beforehand. Every group, a lot of times, who they have that hour is who's there. So you can't, it's not cookie cutter. You really can't say that this month is going to be the same as last month's. It could be different depending on who shows up and what their needs are at that time. So I do get I like to really inform people on how to approach a support group if it's your first time.
That is awesome advice.
Yeah.
And thank you for sharing that because I didn't think of it that way. I just said, go in, see, you're not tied to anything. Go in, you don't like it, leave. It's kind of like any kind of group, even when you're a kid, like, okay, they're mean, forget it. Yeah. Not that I'm saying they're going to be mean, but in a kid dynamic. Yeah. But it might not be your group, and it's okay. You just try another one.
There's plenty others, right? But there's so many barriers. Maybe it's I don't want to see somebody in a wheelchair. It's always I don't want to see someone worse off and know that that's my future, right? It's let's talk about the barriers first and let's strip that away and then let's see why you can go. And the truth is there's a gazillion groups out there. So you might not want to go into a group that has advanced Huntington's or PD. You might want to go to a newly diagnosed group. That's why there's all different groups out there. Yeah. So do the research before you just jump in.
That's very smart. Now tell me, I want to spend a moment on a nonprofit that is very near and dear to your heart and that you do a lot of work with, and they do great work. Can you tell us a little bit about it?
Yes. So I sit on the board of a nonprofit, Virginia Ann's Angels, and Patricia Hackenjoss is the president and the CEO of the company, of the not-for-profit. It is truly, when I got called and asked to be on the board, I really felt like, wow, this couldn't be a better time. This organization is strictly designed to provide financial support to individuals and families dealing with Huntington's disease.
Okay.
And the reason for that is there really isn't a lot out there for HD. There's a lot of wonderful, there's HDSA, there's a lot of wonderful research out there, but when it comes to the actual local patient-to-patient support services, it can be limiting. And also the Huntington's disease community doesn't really know how to reach out for help either, because they're just, in a war all day long, depending on how many family members are living with it. So this organization really is designed to ease a little bit of the financial burden, whatever that might be. So maybe you need money to get to your physical therapy. Maybe you need a little extra funds to cover a wheelchair that you really need. Maybe you need groceries paid for. Our goal is to try to help pay for that. Literally grassroots, from us to the patient. No middleman.
Wonderful.
So, we are still very small, we're growing, but it's an incredible mission. The family who is running this obviously is living with HD themselves, and this is their way of giving back too.
That's amazing.
And you see that a lot. You see individuals that feel compelled that, this is, I don't have to carry this in the way that my sibling did, but I can still do something.
Right.
You know?
Right. That's wonderful. And so tell us the website for them.
VirginiaAnnsAngels.org.
Okay,
Yeah,
excellent.
yeah.
So look for them, support, as well as look for services if you know somebody that has Huntington's disease or you want to share that information.
Yes.
And also, where do people find you if they want your great services? Because if I'm correct, you deal with patients with neurodegenerative diseases, but also other patients with different
So
concerns and issues.
My primary focus has always been obviously the Medicare population, but of course I do work with individuals and adults dealing with just life transitions, general concerns, anxiety, depression, some ADHD. You can find me on Psychology Today. You could just look up my name, Lucia Jamaluddin, and you'll see my profile up there and a way to connect with me.
Excellent,
Yeah.
excellent. So again, thank you so much for being here.
Thank you for having me.
You've always been such a wonderful resource and are excellent at what you do.
Oh, thank you, Nicole.
And so I thank you from the entire community and Long Island.
Thank you.
And let me just ask you one more question. Do you do online therapy visits or just in person?
Oh, good question. Everything at this time is all virtual.
Okay.
Yes.
Okay, great.
Yes.
So you can be anywhere.
Yeah, anywhere. Thank you.
And get her fabulous services. So thank you again so much for being here. Thank you for being here. And we'll see you next time.
Thank you.